All right, thank you all for joining us and good evening. Tonight is the information session on the forensic hospital that's going to be built adjacent to New Hampshire Hospital. This is our sixth information session since we started this effort about a little over a year ago. My name is Jake Leon. I'm the Communications Director for the New Hampshire Department of Health and Human Services. Tonight, we'll hear from representatives from the New Hampshire Hospital, the New Hampshire Division of Public Works, as well as PC Construction, which is handling construction of the forensic facility. Before we get started, a few notes. As you heard, tonight's meeting is being recorded. The recording will be posted on the DHHS website tomorrow. If you have concerns regarding recording, please disconnect now. All lines except for the presenters are muted. Please submit your questions in the question and answer feature. Each question will be addressed this evening. And please use the chat function if you have any technical issues or problems. We will not be able to address non-technical questions submitted to the chat function. Please use the question and answer feature. Tonight's meeting was announced to the press. There may be members of the media present. I just want everyone to be aware. And with that, I would like to introduce Ellen LaPointe, CEO of New Hampshire Hospital, who will get us started. Ellen, the floor is yours.
Hi, good evening, everyone. Thank you so much for joining us. Kathy, do you mind, unless my view is off, to pull up the slide deck for me? Let me just confirm. Can anyone else see the slide deck?
No, Ellen, we don't. Yep.
There we go.
Good.
Thanks so much. All right, good evening, everyone. I'm Ellen LaPointe. I'm the CEO at New Hampshire Hospital, and I am pleased to be here this evening to be presenting the sixth community outreach session for the forensic hospital that will be a part of New Hampshire Hospital. And let's jump into tonight's presentation. All right, so from an agenda perspective, I wanted to share with you all, some of you may be new to these sessions. As I mentioned, we have had some previous ones, so a little bit of this might be repetitive for some of the folks that have joined in the past. However, we do want to give you some information about where to find the recordings of each of the previous public outreach sessions that we've already held. And as Jake mentioned, this public outreach session will also be presented on that website tomorrow. Next, we were going to talk about who to contact. Sorry, can you back up? We're also going to talk about who to contact with any questions about the forensic hospital. We're going to share an updated forensic hospital timeline. I'm going to introduce you to some folks from PC Construction, and they're going to share with you some additional information. And then at the end, we're going to provide some additional New Hampshire Hospital updates. PC Construction is also going to talk a little bit about a map of New Hampshire Hospital. We're going to talk about some forensic hospital operations and then refresh some of your memories in regards to some of the renderings that our architecture company, SMRT, provided for us. So today's session, as I mentioned, is our sixth community outreach session. There have been 5 community outreach sessions prior to this, and they've occurred in October 2021, January 2022, March of 22, June of 22, and November of 22. So this is our first public outreach session in 2023. However, we've remained active since our last public outreach session, and we'll update you in a moment with the timeline. I did want to mention too that we'll have at least 2 more community outreach sessions during the construction of the forensic facility, anticipated at midpoint as well as at the end of construction, but we're happy as always to be flexible in adding some additional community outreach sessions as we progress in the project. So where to find the recordings of each of the public outreach sessions so far? You can go to the New Hampshire DHHS website. That's www.dhhs.nh.gov. And then there is a map down here of how to find the public outreach sessions. Without going through that in detail, just take a peek. They're not too hard to find, but you can always search the site at the top of the page, and you can type in New Hampshire Hospital Forensic Hospital or Forensic Hospital, all of which should get you to the right location. And this is the same contact information that we have provided throughout these forensic hospital presentations. Feel free to reach out to this email box with any questions. It is our New Hampshire Hospital Admin Support mailbox. It is checked Monday through Friday. There are a handful of staff members at New Hampshire Hospital who have access to this box. I have received some questions through this box, and we've been able to comply with around a 24 to 48 hour time frame in response. And sometimes it yields me to ask for some additional support, whether it be Department of Public Works or others, but we are committed to try to make sure we answer any questions that come through this mailbox. So here is our updated forensic hospital timeline slide. This might look familiar to some of you that have previously joined some of these meetings in the past. And again, just to orient folks, the orange bar is the years, of course. So you can see that we've been working on this project, at least for the design phase, for a number of years now. And then when we go down to the design phase, which is around the middle of this timeline, you can see all the work that was performed during 2021 and 2022. And then here we are in 2023. Go down a bit more, you can see those yellow circles. Those are the public outreach sessions that we've had at each phase of the project. And towards the bottom here, you can see that for the last several months, we've been working on bidding for the construction company, the governor and council approval of that bidding process. And then here we are in right around August of 2023. And then as we move forward, which you'll hear from members of PC Construction in just a bit, we're going to be moving forward into the construction phase of the project. Now I'd like to take a minute just to hand it over to PC Construction, to John Kelly, who is the project lead. I think I got that title wrong. I wrote it down earlier today, John, but I don't have that notebook in front of me. Feel free to take it away.
All good. Thanks, Ellen. I'm John Kelly. I'm the project manager for this project for PC Construction Company. I'm actually joined here with two other coworkers, Claude Benjamin, project superintendent, and Nick Rouleau, also a project superintendent. We actually all live and work local in Hillsborough County. As you can see, there's a quick just about us. You can see we're kind of spread out a little bit around the Northeast and the Eastern Seaboard. However, we have an office right in downtown Manchester that serves projects all across the state. We've been established in the industry for a while. Here's just a few quick metrics about us and who we are. If you go to our website, you can find out a lot more about us and see kind of some of the projects we work on along the whole Eastern Seaboard. So I'll give you an example of some of the work we do. We've been in the industry for a while, as I mentioned, doing business in New Hampshire for over 45 years. We've done a lot of different kind of works. If you go to the next slide, Kathy. Here's some examples of some cool projects that we've worked on recently within the state, from Portsmouth to Lebanon to Bretton Woods and Mount Washington. We've done a variety of different kind of projects in terms of healthcare, resort, residences, and some unique projects at pharmaceutical manufacturers and UNH. We just downsized their ice hockey rink from Olympic size to NHL size. So this is kind of just a little bit more about us. So we touch all the markets of construction, but we have a real focus also on the healthcare, as you saw in that first slide. We've been doing this for a while, and kind of some of the example projects that we've just finished recently that are similar in terms of the project scope and size for healthcare and behavioral health within New England, just to kind of highlight some more of who we are. Just showing some brief pictures in the project description and the location. So these are first two projects based in Vermont. The next one, CVPH in Plattsburgh, New Hampshire, and then in Southern Maine and Sanford. So these are kind of the projects that we work on. We do have a good deal of leadership and knowledge within this space, and we're happy to be part of this project team. Go through and next slide, Kathy, just talk briefly about what we're doing. If you haven't been to the site recently, it's slowly starting to change. Here's a view of kind of just the general work area. As you can see highlighted in blue kind of is the focus of that project. But we're also touching a lot of areas around the campus. One, to protect everyone from what's happening on inside the fence, but just to make sure everyone's on the same page with traffic flow, pedestrian flow, and others. So work site safety is very important to us. So if you go there now, you can kind of see where the trailers are being set up. The fence has gone up. You'll see some additional signage, some road paintings. And as the project evolves, you'll see this area change. And as we come out of the ground in the next few months, you're going to see a lot of progress quick, which we're very excited about getting started on. So appreciate everyone's time tonight. Like I said, we're excited to get working on this here. And I'm going to turn it back over to Ellen to go over some additional updates. Thank you.
Thank you, John. That was great. So in terms of some additional forensic hospital operational updates that are occurring, as you saw on the project timeline, it's going to take approximately 2 years to be able to complete the construction of the forensic facility. And I wanted to let folks know that that time is going to be well utilized, not only by, of course, the construction team, but also the team at New Hampshire Hospital, as well as others within the department, and in partnership with other departments, such as Department of Corrections. So we, in the past several months, have been working on some operational planning for the forensic facility and are working on things such as our policies and procedures, our regulations that we have to follow, what accreditation we're pursuing, all of the patient programming, what contracts need to be in place, IT, security, of course, staffing, and staff training, just to name a few. So we're going to definitely be taking these next couple of years to plan and prepare so that when everyone is ready, that we can start admitting patients into the forensic facility. This picture that I have up here for you, can you go back, Kathy? Thank you. This picture that I have up here for you is the start of kind of a refresher to some of the renderings that we've showed in previous sessions. And this is an aerial view, aerial rendering of the white, which is our current hospital footprint, New Hampshire Hospital footprint. And then to the right-hand side here in the gray is the forensic hospital addition footprint. Kathy, next slide. This is a rendering of the front entrance. So this kind of left-hand half of this slide is similar to the pre-existing front entrance, although does have some modifications as well with these concrete barriers and whatnot. On the right-hand side is actually where the forensic hospital addition will be located, behind these beautiful renderings of trees. And before we go to the next slide, I just wanted to remind folks that SMRT has worked very hard to maintain the location appropriate plantings and landscaping for the forensic facility as well. So we want to really make sure that we're keeping in tune with the beautiful space that we have on campus in terms of what we have for plantings and landscaping. Next slide. So this is a entry rendering. So if you were to pull into the hospital driveway now, on the this little road to the right-hand side of the slide here, that's where fencing exists currently. Is actually both of these roads, fencing exists currently. That just went up this week. And you can see on the right-hand side over here where you'll see the rendering of how the forensic hospital will fit into the New Hampshire Hospital campus. And then this is going a bit further west. So again, this is really focusing on the addition in its entirety. And you can see the forensic facility here. This black square will be where we admit patients into the forensic facility. And then a little bit further to the right will actually be the courtyard area, which is focused on a little bit more in the next slide. And this is a focus in on the courtyard. So this is secure outside space where patients will be able to have access to while they're staying in the forensic facility. And you can see that it is planned to be of 16-foot height and a combination of steel, welded wire mesh, and wood planks. And then down here on the bottom of the slide, this is an example of a facility in Vermont and what their outside courtyard area looks like for fencing. So try to really incorporate some really nice features, but also maintaining safety. I want to pause for a second and just allow Becca from SMRT to jump in. If you have any additions, Becca, I know we went through those rendering slides a bit quick.
No, I think that's, sorry, my mouthpiece. I think you've touched on it, but I'm happy if questions come up during the Q&A, I can jump in and provide any other detail.
Perfect. Thank you, Becca.
Thanks.
And that really concludes our presentation for this evening. We were excited to introduce you to the PC construction team and excited to start our work with them. As they previously mentioned, there are some things happening on the campus right now, and their commitment to safety and security of the space has been excellent. And we look forward to working with them throughout the next couple of years on the project. And that's it.
Great, thank you, Ellen and Becca and John. Right now, we are going to turn to question and answers. Please, if you do have any questions that you'd like addressed this evening, please use the Q&A feature at the bottom of your screen. I'm going to take the questions as they come in. First question, it was recently reported that 22 individuals were in the SPU by the union leader. Yet as of July 1st, the DOC census shows roughly 40, including 2 individuals with developmental disabilities, who've been there for more than a year. What are plans to manage capacity with only 24 beds? Along the same lines, this is going to be a question for Ellen and the experts at New Hampshire Hospital. Is the state going to cease using SPU for civilly committed individuals after the facility opens? And will tasers be used on these individuals as they are in the SPU? Ellen, do you want to start with those? And I can go through each one individually if you like.
Sure, let me get started. And
yeah, the
as you
first
mentioned,
question is, what are the plans to manage capacity with only 24 beds?
perfect. And as you mentioned, there are a couple of additional folks on the panel this evening who are going to help me out. We have Dre Mouchette, who's been on previous panels in the past, as well as Cindy Babonis and Dr. Daniel Lampignano. So let me get started, and then I'll lean on the team to help me out to make sure I covered everything. So in regards to the SPU, not all of the current patients that are in SPU would be appropriate or necessitate transition to the forensic facility. It is the intention for the SPU to remain open and in service to the Department of Corrections for those individuals who need to remain incarcerated. There is some preliminary plans in place if there ever was a need to be able to expand the capacity of the forensic hospital. That has been taken into consideration and some designs developed by SMRT if that were to be the case. However, starting out with 24 beds, we do hope that we can make a difference for those folks who are currently civilly committed in the SPU. Dre and Dr. L and Cindy, anyone want to jump in on that one?
Just to say that I think that that's right. We have a certain capacity that we have to work with, and we're gonna do our very best to serve the needs of New Hampshire and this particular population, as we're able to. And we do have some. The design was created with expansion in mind. So as that becomes apparent and available, we'll be able to build on what we have.
Great, thank you, Dr. Lampignano. And in terms of the next question, with ceasing the utilization of SPU for civilly committed individuals, the The short answer to that is yes, that is the intention. However, there is a possibility of some alternatives being considered. And Dre, I'm going to have you jump in on that one and explain a little bit.
Okay, I can jump in. So not all the individuals that are at the secured psychiatric unit are a 135C commitment, or they are a kind of a dual commitment where they are a state sentence inmate as well as a 135C commitment. So that decision will be made between ourselves and working collaboratively with the Department of Corrections to figure out which environment would best suit the patient and their needs at the time.
Thank you, Dre. So we tried to make sure that we're not confusing folks with the different levels of commitment that occur. And however, it suffice it to say that, you know, we would work in close collaboration and have been working in close collaboration with DOC in preparation for these transitions, and we'll continue to have those conversations. However, as I mentioned at the start, it is not the state's intention to civilly commit unless the legal and statutory circumstances were to warrant that. And the last question is in regards to tasers. Again, the short answer to that question is yes. New Hampshire Hospital in its current state also has state office complex police who are part of the state police force and are trained via the academy and ongoing training for the use of force, which in our environment could and occasionally does include the use of tasers. The deployment of tasers is relatively rare in New Hampshire Hospital. However, yes, I would imagine that we would prepare for the utilization of tasers in the forensic facility as well.
Thank you all. Okay, next question. Are you going to have a groundbreaking ceremony, and if so, when? Happy to answer that. I think we're still determining if there will be and when, but we'd be happy to let folks know if we do have one. We will certainly let you know if we do have one. There's a couple of questions here I'm just going to loop together on the estimated costs as well as the timeline. Kathy, can you go back to the timeline slide in the presentation for Ellen to refer to? And just curious, based on inflation, if we, how much is anticipated to cost, and when do we think it will open?
Can you see that, Jake?
We can, Kathy. Thank you.
Oh, shoot. Sorry.
We had it.
Sorry.
That's okay. All right, Ellen, if you want to tackle there we go. Okay.
So the questions in regards to inflation.
Yeah, the fact that inflation has impacted costs. Where are we now? And
I can, Jake, I can address
great.
that.
Go ahead, Keith.
I think the tenor of the question is if that cost has been built into the contract price, and it has. The bid contract is set at the amount that the contractor bid it. We don't have escalation costs built into the contract, if that's what the question is. So there shouldn't be any increase in the cost of the project simply due to inflation.
Okay. And then Ellen, here is the timeline is on the screen. We're looking at the second quarter of 2025 for completion. Is that correct, Ellen?
Yes, that's our current anticipated timeline to be able to finish the construction of the forensic hospital in the summertime of 2025.
Great. Next question, if counties transfer individuals to the SPU, will the counties be responsible for paying?
That's a great question that I don't actually know the answer to, but I'm happy to try to do a little bit more digging. I can tell you that the counties don't currently cover the cost of any patients who reside in the hospital currently. However, that isn't yet something that, oop, I think I froze. That isn't yet something that we've discussed in great detail.
Yeah, maybe the question for DOC we can address the next time. Will there be opportunities in the next 2 years for mental health advocates and other interested people to discuss policies and procedures regarding admissions, treatment, etc.?
That's a great question. Thank you for asking. Yes, we continue, and that's part of what these community outreach sessions are for, is to really start that preliminary engagement with the public. And then if there's additional feedback or desire to partner, we're definitely open to having those conversations and have good relationships with those community partners and advocates. As you know, in current state, Susan Stearns, the director of NAMI New Hampshire, has been on a previous community outreach session. And, you know, as well as we have relationships with other advocates as well. So thank you for that. And we would definitely take that into consideration.
I'm just going to read this outright and we can pick it apart if we need to. What is the other agency where the unused federal funds are coming from to pay for the cost overruns? I don't know that there is another agency, but it was just repurposed from within the department, correct?
Mm-hmm.
Okay, no other agencies is contributing.
Correct.
Will this facility accept adolescent patients if the Hampstead Hospital site reaches capacity?
I don't think I could, I don't think I could speak to that currently. However, New Hampshire Hospital is designed for adults. So, you know, however, we work very closely with Hampstead and we would be open to any level of collaboration to make sure that needs are met. And that's existent in our current state as well as future state.
Great, thanks, Ellen. And how will the new forensic hospital affect NGRI patients, individuals not guilty for reasons of insanity?
I'm going to lean on Drs. Neuchette or Lampagnano to help me with that.
Short answer is we don't know. Yeah. That the forensic hospital has been an opportunity to examine the state's policies regarding all things forensics, including NGRI. And I think that that's a great opportunity to open this discussion and continue this discussion and partner with other agencies and the Attorney General's office and so on. So we'll see what those conversations yield.
Thank you, Doctor. Now, a follow-up question on costs. I think providing we may have misunderstood what was being requested. Just try to read through it.
Jake, want me to help with that one?
Yeah, go ahead, Commissioner, please.
Yeah, I mean, I think when we went out for the bid, we realized that we were short a significant amount of money from the lowest bid. So we repurposed money within our existing budget to be able to award that contract at the price specified.
Thank you. Last question that for right now is what is NGRI? And that is individuals who are found not guilty by reason of insanity. All right, one more question. Will trucks be directed via the back of Ring Road forever or just during construction? Will the playground within the facility stay without children using the facility any longer? Will the other construction that is going on continue, or is it getting close to completion? That's referring to the back of Ring Road. Sure.
Great questions.
Yeah.
So in terms of the Ring Road, which is around that footprint of New Hampshire Hospital in its current state, part of which, as you saw in the previous map, is closed off currently. However, traffic is being directed around the back of the facility, not consistently, because that's also where our loading dock is located. So that's often where truck traffic goes when they're coming on our campus. And in current state, yes, that is where truck traffic is also going, because we do have, as this mentioned, a couple of other additional construction projects that are occurring simultaneously as the start of this project. And just a quick update on those, which I think was a part of this question. We had some water damage that occurred back in February on 2 of our units that were unoccupied. And we also had a renovation project that has been many years in the making for those 2 same units. So we currently have 2 construction teams on site who are working hard and on schedule to get those projects completed, hopefully by the end of this calendar year.
Thank you, Ellen. Now the next question, go ahead.
Sorry, Jake, I just saw the playground. There isn't current plans to remove the playground. However, we no longer have youth residing at New Hampshire Hospital, so that's something that we would take into consideration during construction.
Oh, good catch, thank you. When we set the policy to build a forensic hospital, we were told that NGRI patients would be appropriate for the admission. Are we changing our approach now?
I think what we're saying is that it's not necessarily a hard, fast answer to indicate that if someone is NGRI, they would automatically reside at the forensic hospital. We're trying to be really diligent and appropriate in terms of who is residing in this location. Of course, it'll come along with high security and staffing needs to be able to meet the acuity of those patients. So I don't want to say that the intent is that every single NGRI would be at the forensic hospital. I do think there is a possibility that some will be, as some are currently residing at New Hampshire Hospital in current state. So it's really going to kind of evolve over the next couple of years in our partnership with Department of Corrections and other state agencies, as Dr. Lampignano mentioned.
Thanks, Ellen. Well, that was helpful. Okay. Well, at this point, I have we've gone through the questions that have been submitted. If anybody else has any additional questions, please type them in now. But if we've reached the end of the questions, we certainly do thank you for your time and attention to this important matter, and know that we will be back in front of you as the project continues. You will have additional opportunities to answer, to ask questions. But if you think of questions when we're done, Ellen, can you remind everyone of the email address they should send questions to?
Absolutely. I'll put it in the chat as well, but it is nhhadminsupport@dhhs.nh.gov.
Wonderful. Okay. Well, seeing as we have reached the end of the questions, we will call it a night. Thank you again for participating again and for bringing such thoughtful questions on behalf of New Hampshire Hospital and the Division of Public Works, as well as PC Construction and SMRT. Thank you for attending. As I mentioned earlier, the session will be posted on the DHHS website in the next day. We'll keep you updated on this project during future information sessions, and please send feedback at the address that Ellen just provided if you have additional feedback after the session is over. And with that, I will bid you all a wonderful evening. Thank you and have a great night.